Hello, my name is Dr. Syed Arshad. I'm a consultant pulmonologist. I'm also adjunct professor in pulmonary medicine at the Gulf Medical University in UAE. I have been asked to talk about the subject of cough, which is a very common reason why people consult their doctors. About 30 million consultations happen around the world with symptoms of cough. So you can imagine how common this problem is, and 40% of the consultation that come to doctors like me, pulmonologists, is related to coughing. And usually we divide the cough, the duration of the cough, into different categories. So if they have been there for 3 weeks, we say this is an acute cough. If they have been present there for 3 to 8 weeks, we call it subacute cough. And if they have been there more than 8 weeks, the cough, then we call it a chronic cough. And chronic cough usually means there is something pathological about the lung. So this is why it is important. If the cough is persisting, don't ignore this symptom. Please see a doctor, and maybe a pulmonologist would be more appropriate to see, because the chronic cough or prolonged persistent coughing could be sign of lung cancer. It could be very serious disease if you are a smoker and if you're in the right age group. So please, when there is a cough which is persisting and unclear, do see a doctor, a clinician for that. The important thing is that most of these coughs would clear up with time, but some would not. The common causes of acute cough are usually the viral related illnesses, they cause the acute cough, while the chronic or subacute cough is usually because of some pathology. Now, when you see a doctor or a clinician, they normally do an X-ray. If the X-ray is normal, then this means there is no serious pathology on the lung that has been visualized. When there is nothing seen on the X-ray, then there are very few, 3 to 4 conditions which will be prevalent as a cause of this cough. And top of that differential would be bronchial asthma, allergy in the airways. Other common problems which also occur is allergic rhinitis, this postnasal dripping that can happen, which can lead to coughing, especially people who have allergy in the airways or in the upper airways. This will be a problem. The second thing is to remember that gastroesophageal reflux or gastric reflux, if you have gastroenterological disease, could also sometimes go to the windpipe and go into the airways, causing a cough, which is usually a problem. So along with that, sometimes cystic fibrosis is another congenital condition which can lead to coughing. The common causes of coughing again are acute bronchitis, viral illnesses. We touched upon the common viruses, influenza A and influenza B, and also sometimes COVID-related viruses could cause acute coughing. Along with that, bacterial infections, pneumonias or TB, and not to forget, can cause a cough. We talked about asthma, postnasal dripping, gastroesophageal reflux disease, and we talked about cystic fibrosis, but equally we should talk about bronchiectasis, which usually means a dilatation of the airways, would not usually show up on an X-ray, and again would cause the coughing. A whooping cough in children especially is another cause for coughing. And lung cancers, not to forget, is the very important reason for a chronic cough, persistent cough in a smoker who is above 40 years of age group. It's a disease in that age group which affects people who are smokers. So if the cough is persisting, please don't ignore it. Please get early attention, because God forbid if it was a lung cancer, early diagnosis, early detection can make the difference. Thank you.